So we're going to talk for a moment about the signs and symptoms tool that we created for people who communicate without words. So this is going to be something that is used by people who serve someone who might communicate to you not using the verbal speech, maybe using sign language, maybe who are unable to speak, and people who you need to look for the symptoms of the concussion a little more carefully to understand what kind of symptoms and what kind of problems they might be having. So we created this because we are working with people who serve people with developmental disabilities. There are always younger people, older people, people with different types of developmental disabilities and other communication related disabilities, and even other areas that they just may need some extra help in figuring out what type of symptoms they're having, and might be a little trickier to understand if they may have experienced a concussion or might be living with symptoms from a concussion. So we put together this version of our signs and symptoms tool. Many of the symptoms are the same, but we've made a few special changes on here to make it easier for people who are family members of or who are healthcare professionals who serve people who communicate without using words. So we have the definition on here of concussion. We have danger signs, that's in the red. We want to make sure and point those out because those are things that if you see someone exhibiting those symptoms, nausea or vomiting, one pupil larger than the other, really disoriented or confused, shaking, if those things are happening, you want to see a doctor right away. That would be an urgent need for help for concussion or brain injury. We list on here many of the same symptoms as in our other signs and symptoms handouts: changes in headache, pain, balance, sensory changes, changes in sleep. Some of those are going to be more gradual and something that you notice over time. What we want you to know is if you see a danger sign, get help immediately. If you're noticing some of these other symptoms, take note of them. And then we have that what to do section. Get the treatment from a person who's experienced in treating someone for concussion or brain injury. Might be a neurologist. You might need a neuropsychological exam. You might go to a specialist who sees people for concussion, a rehab center, or someone who specializes in that particular symptom. Now let's look at the back. We do list many more types of symptoms on here. Although there are so many symptoms on this front and back, this is not a complete list of symptoms that someone might have. And you want to keep in mind someone may experience one of these symptoms, three of these symptoms, or any combination of any of these listed on here, or something that's even not on here. This is just a good overall view of categories of symptoms that they might experience and are more common. So this might be changes in cognition, someone who's irritable, quick to anger, having more changes in behavior or emotions, fatigue, dizziness, signs of pain might be for someone who communicates without words, being more agitated, crying more easily, facial changes like tensed or stressed. These are things that might be a little harder to notice unless you're really aware that it could be related to pain. Changes in sleep, more stomach aches. This section, changes in eating habits, continence issues. We've also adapted this for our children who are under 5 years old and who may communicate without using words. Our little ones who might not be able to explain exactly what's going on, but just like a parent would use to understand the symptoms a child's having, they might just know that person very well and know that this is not how they usually act. This is not typical for them. So you want to think about what has changed since the injury. If you know there was a concussion, if you know there was a head injury that occurred and you suspect there could be a concussion, um, it's it's really smart to think about these as changes since the injury. If you don't know that the injuries occurred and you're seeing these changes of something that's not typical for that person, that's what you want to look for, because some of these may start to make you think, well, this person's already having a little trouble with judgment, or maybe kind of an emotional person, or has some behavioral issues already. We can all look at a list of signs and symptoms and think, well, this is sort of like me on any given day, or this is what my child or my student or my patient is like. And we're looking for something that's new and increased or changed for that person. So a few more symptoms that you might want to look for: changes in sleep, um, night walking, changes in appetite, not eating their favorite foods, covering or squinting, closing their eyes, more tantrums. These would all be things that are really different since the time of the injury. And one of the best things on here that we want to point out is at the very bottom, the contact information for Brain Links. We're part of Tennessee Disability Coalition. The contact information for your traumatic brain injury program, that would help people get in touch with services they may not even know were available, like the Tennessee Service Coordination program for people with traumatic brain injury. So this one piece of information can tell people a lot of things that they need to know, either urgently if there are symptoms that they're seeing, or for things to look out for down the road, and be able to get the help that they need. Thanks.